Hello everybody. Today we are going to discuss about epilepsy. Epilepsy is not a newly discovered condition. It is well-known condition since ancient times, and there are reports about epilepsy more than 3,000 years. And we are aware that it's a very well-known medical condition. About 50 million people are affected worldwide. Let us understand what epilepsy is about. There is a clear difference between epilepsy and a seizure. Seizure is an isolated event. Epilepsy is more than one episode of a seizure. In a patient with seizure, there is a clear-cut known conditions, known abnormalities like some metabolic abnormalities like renal failure, hepatic failure, excessive alcohol, or some drug effect, or increase or decrease in the blood sugar levels. And usually if we treat these conditions, seizures often do not recur in a person. But in epilepsy, seizures occur again and again and they are unpredictable. Are there any types of seizures? Or are there any types of epilepsy? Yes, depending upon the area of the brain affected, the types can be different. It can be from a single area of the brain affected, which we call it as a focal epilepsy, or it can be a generalized epilepsy. How do you diagnose? Or how do you suspect that a patient is having a seizure? Usually, a patient with epilepsy can be described in three different activities. What happens is in the beginning, there are some symptoms. When an individual starts getting a seizure, he will get some warning symptoms. What we call it as an aura, which can be an abnormal smell or sound, or maybe some thoughts. Patients may get some thoughts that could be a sign of an attack is going to happen. Some strange feeling. They may have panic, fear, or anxiety. They may have lightheadedness. This is what we call it as an aura or premonitory symptoms. During the seizure or middle of the episode, patient can have motor manifestations. They can have sensory manifestation. By means, they may have jerking, they may have tongue bite, they may pass urine involuntarily, they may have drooling of saliva, or eyes may go up, jerking of the body. This is a typical generalized seizure. But in case of focal seizure, they may get jerking of one particular part of the body, or may they just stare at towards particular object, or maybe just staring, simple staring, some eyelid fluttering other movements, or they may become unresponsive, or sometimes they may just wander aimlessly. This is what we call as complex attacks. And these complex attacks are usually associated with some automated behavior, something like lip smacking or some abnormal movements in the hands. So this is what we call as an automatism, which is associated with the complex partial attacks. End of the seizure, that's the third part of the seizure, is a post-ictal phenomena. They may have a confusion, they may have difficulty in talking, or they may have just a abnormal behavior. Sometimes they become aggressive. That what is called as a post-ictal psychosis. This is about the event of the seizure. Next, what are the causes? So the causes can start from genetic causes. There are some abnormal genes which are responsible for epilepsy. There are familial causes. Some of these seizures or epilepsy is genetic or familial in etiology. Or there may be some acquired causes. Acquired causes like during the childbirth, the child may get trauma during the childbirth, or they may get sometimes they may have some episodes which will produce a decrease in the blood circulation or the oxygen supply to the brain, and they may develop a scar that can result into epilepsy. Similarly, adults they may have scar seizures. Sometimes they may get a stroke, and that can produce a scar, which can be because of ischemic stroke, or it can be because of the hemorrhage in the brain. It can be because of tumors in the brain, or it can be because of infections in the brain. These are the acquired causes. And the later age, the patient may have dementia, and dementia can also be associated with the seizures. So these are the different age groups can produce seizures in different age group or different etiologies. And what are the factors? There are so many factors which can trigger the epilepsy or trigger the seizure. What are the factors which can trigger the seizures? Most of the times, once we start patient on medications, Most common cause of getting an attack is stopping of the medications without doctor's prescription or without doctor's consultation. Stress, sleep disturbance. In ladies, sometimes menses can precipitate the seizures. Sometimes fever, any infection in the body can precipitate the seizures. Sometimes excess alcohol intake. Some patients who are diabetic, they forget taking up anti-diabetic medication. The sugar can go up and can precipitate the seizures in a patients who are epileptic. So these are all obvious precipitating factors. But taking medicines regularly and keeping stress away can definitely prevent trigger of the epilepsies. Now, how do you diagnose the epilepsy? It is a basic teaching in epilepsy. So, the diagnosis of epilepsy is entirely clinical. Though there are investigations, but entirely clinical. Clinical means a good history can give us a diagnosis about epilepsy. Many times we face a problem when the eyewitness is not available. Many times we need to take a history of an eyewitness, which is a cornerstone in the diagnosis of epilepsy. If we get a good history from eyewitness, that's it. But sometimes the history is not very clear. We need to take help of EEG and some investigations like CT scan, which will help us to substantiate what we are thinking. And secondly, it will give us a classification of a patients with epilepsy. What type of seizure the patient is having? What is a possible reason? How are you going to classify this type of epilepsy, and what could be a potential treatment modality in this particular patient? So sometimes blood tests we do, but blood tests are usually done to know what are the drug levels and the side effects of the drugs, or sometimes we need to start some particular drugs. We need to get a liver function test, a kidney function test before we start medications. So next is how do you treat a patient with epilepsy? All of us know, apart from the lifestyle, apart from these trigger factors which we need to modify, which we need to take control, the mainstay of the treatment is the drugs. There are so many drugs available for epilepsy. The selection of the medication depends upon the type of the epilepsy, the age of the patient, the gender of the patients, and any related illnesses, which will help us to select a particular medications. In majority of the cases, say about 80% of the patients, the drug treatment is successful. In sometimes, some cases which are refractory to epilepsy, we can think about a surgical treatment. Of course, failure of 2 or more drugs and refractory to medications. These are then some patients who are some perinatal period insult and some problem during the childbirth producing epilepsy. Sometimes surgery can be of a help in some selected cases. And the duration of a treatment is usually in a patients who with idiopathic seizure disorder, idiopathic epilepsy. Usually the patient is symptom free, disease free. Sometimes or many times we can reduce the medications, taper the medications in about 2 to 5 years time. But many times in adult, this is possible in pediatric age group, idiopathic epilepsies. It is possible to reduce medication in 2 to 5 years time. In the patient has onset in adult, maybe we might need to give the medication a little longer, and sometimes if we try and taper the medication, there may be a recurrence of the attack, then we have to reconsider the treatment, and treatment we have to give it for 3 to 5 years. There are sometimes people ask us whether the epilepsy can be cured. This is what I say, sometimes in pediatric age group, we can definitely make a patient seizure free in about 2 to 5 years time. But in adults, it may not be possible every time. And another important aspect which I need to really tell is the misconception about epilepsy. Sometimes we see in society social stigma. Many times they say it is because of past sin, or many times patients come with a symptom that they cannot get married, or sometimes they say marriage can cure the epilepsy. All these are misconceptions. Sometimes they say patients epilepsy can happen in a patient with mentally ill. Actually, it is not a mental illness, and many times they may have some mood disorders because of the chronic epilepsy or the recurrent seizures. They may have some mood disorders, they may have some anxiety, but it is not a mental illness. And sometimes many people say it is because of your past sin, which is not. It is like like how you suffer from disease like diabetes, hypertension, blood pressure. Epilepsy is a medical problem of the brain and can affect irrespective of his or her past deeds or the characters. Sometimes the patient says, or the parents come with history that once you start anti-epileptic medication, the children may become dull. which actually is not. In fact, after starting the medication, their cognitive performance improves, their performance in the school improves, and that is the reason why we always tell the parents as well as the teacher not to discontinue the medication, in which in fact improves the scholastic performance in children. There are so many new drugs which have very less effect on the cognitive functions of the child. Another important thing, many times the people, they give keys, they give onion, or they give shoes to the patient to smell, so that the attack will disappear. Actually, this is definitely irrational beliefs, because once the electrical activity starts in the brain, it subsides on its own over a period of time. Giving all those things or making patient to smell onion or the shoes is not really going to make a difference. In fact, we should be careful enough not to harm the patient who is suffering from an epileptic attack. And another thing is, patients with epilepsy can get married, they can have children. So it is not that epilepsy, marriage is a treatment for the epilepsy. And another thing is, many times people ask whether these people are fit enough to get married. Definitely yes, they can get married, they can have children. Only thing is what they need to continue medications and be under proper supervision. And if they lead a happy and stress-free life, the epilepsy person can lead a normal life. The other thing is, now what are the do's and don'ts in patients with epilepsy or a patient with seizure? Most important thing which I would like to highlight is, take medicines regularly. Your disease should be known to your family members, your disease should be known to your friends, so that in case of emergency they can take care about it. Second thing, you should carry a card indicating a type of epilepsy, what medicines you are taking, which doctor is treating you. So these are important things. If the child, we should always educate the child's teacher and educate about the parents. It's a parent's duty to go and inform them about the drugs what he is taking, and the first aid, which I'm going to discuss a bit later. They should always keep a diary of the attacks, how many attacks he, what are the precipitating factors, how many attacks he has got. They should have a balanced diet. Another important thing is, especially in children, they should not expose themselves to the light radiations, sitting in front of the TV for too long, or seeing iPad or computer or mobiles. That is going to produce a reflex epilepsy. So it is important not to expose them to these type of triggering factors. Another important thing is about swimming. It is better that epilepsy patient should not go to swim alone. They should always be under supervision. So it is not that it is contraindicated, but a person who is very well controlled with epilepsy, they should go to a swim in presence of their parents or in presence of somebody who knows about the problem. Another important thing is they should get a good night's sleep. Less sleep is definitely an important trigger in patients with epilepsy. So we should always take care that patient takes medicine regularly and he should sleep adequately. And important, not to stop medication. Many times we face a problem, the patient starts taking medication. He becomes alright in about a month or 2 months time, no attacks, he doesn't get any attack, and he suddenly stops and comes with a serious seizures. The important thing is not to stop unless until doctor tells you to stop. Should refrain from excess caffeine, excess alcohol, and always when there is a new medication started, always check with your doctor whether this medication have an interaction with the drugs which he is taking for epilepsy. So when he's, and especially elderly people or children's, they are going to toilet, bathroom, see that door is properly not locked properly. Smoking, as I told, as with respect to alcohol, should be definitely stopped in patients who are taking the anti-epileptic medications. What is the first aid in the patients with patient getting a seizure? First and foremost is we should be calm, and very important is patient. We should inform the patient that he should always explain what is happening to the what is happening to the to him. He should explain to whoever is there with him, friends or parents, what he is getting, what are the symptoms he is getting. He should be away from the hard objects. If he is getting, the person who is getting an attack, who knows is going to get an attack, he should be away from the attack and away from the hard object, and he should try and sleep in an area where it is not going to hit him or not going to traumatize him. First and foremost is not to panic, and importantly not to move patient unless until there is an impending hard object or a water where is going to get drawn. And don't try to shift the patient, and don't try to restrict the movement in a person who is getting an attack, because restricting the movement can harm the person who is getting an attack. Second thing, not to try not to put something in the mouth, because many times they clench the teeth. Sometimes there is a possibility of getting injured your finger. So try not to insert anything. Try and make the person comfortable. Do not crowd around the patient. Should be airy, and see that the patient is on a lateral position, with a flexed leg, so that the tongue doesn't fall back and his breathing is smooth. And always not to give any water or anything to drink unless until he is fully conscious. So this is how you need to take care of the patient during the attack. Medical aid is usually not required except in cases where the person is in water or in drowning and has a serious injuries. The duration of a seizure is usually not more than 2 to 5 minutes, after which the person enters in a state of deep sleep. If seizures does not subside, immediately call for a nearest available medical help. So this is what I think adequate for a person getting a seizure, what first aid we should do. And I think if you follow these instructions properly, I think epilepsy can be managed properly, and I don't think there is any need to panic in patients, or parents need not panic about the disease. Thank you very much.